Hey guys, it's me. So I'm back with another medical related video. How about that? And again, in the car, because guess what? I've already recorded one video. Today's kind of like I got to my appointment super early because I had some errands to run before my appointment. So I was like, you know what? I'll get to my appointment. I'll sit in the car. I'll record some videos and kind of get caught up on like some of the personal videos I've been wanting to record. Like, originally I had planned on setting up in my office to record this video, but life's just not happening that way. My days are filled with doctor's appointments and work, and what little bit of time I have, I dedicate it to some of the YouTube groups that I am in order to build our content slash views slash whatever you want to call it. But anyway, so I have come to the realization that I do need to lose some weight. I've known this for a while. I've never really denied it, but I do need to lose quite a bit of weight. Actually, I need to lose to get down to what the healthcare system says is normal. I need to lose like 150 pounds, which I don't want to lose that much weight, to be honest with you. I'd be happy losing just 100. So my OBGYN had suggested, because she wants me to lose a little bit of weight as well, I need to lose about 20 pounds to get put on the fertility drugs I want to be put on. And so she suggested that I go see a weight loss specialist. Well, I went to this weight loss seminar that you have to go to before you can actually see the doctor, and she originally wanted me to go see someone for medical weight loss. So I went to the seminar. They discussed all types of things: medical weight loss, bariatric surgery, things like that. And during the medical weight loss portion, I'm sitting there like, you're talking about meal replacements. They were talking about meal replacements basically for like 6 months, 3 meals a day, meal replacements. So no actual food. You're just drinking your meal supplements 3 times a day, no food, and you're taking vitamins and stuff like that. Well, they went over the cost of this plan that for the 3 meals a day, and it was going to come down to like $150 to $200 a week. And I'm like, that's basically, I can eat, but my husband's going to starve to death. So I'm like, that's just not going to work for me. Well, and then they went over the bariatric options, and I'm like, I've never considered surgery. I've always been kind of against it. Like, I lost all this weight already, when I went on this diet, but like, we went on paleo. Once I got down to like 280, my weight kind of just stopped dropping off. It stood still. Like, there was no more weight coming off of this body. So I didn't know what else to do. So, unlike the rest of the weight I lost was when I had my tonsillectomy, and that's because I didn't eat for like 2 weeks. But I got down to like 250 then, but as soon as I could start eating solid foods again, my weight went right back up to like 270. Anyway, so they went over this bariatric surgery option. There was 2 different options. There was the bariatric, or the gastric bypass, and the gastric sleeve. And they went over both options, and I was like, my insurance isn't even going to cover this anyway. I don't know why I'm listening to it. Well, at the end they said, well, we had the medical guy, or the insurance guy, the guy, HR, whatever, I don't know what, billing. He's in billing. Let's just leave it at that. He's in billing. He contacts your insurance companies and stuff like that, and finds out what they will and will not cover. Well, at the end, you could go see him, and he will tell you, because he's already done everyone that was signed up for this seminar. He'd already pulled all the information, what your insurance would cover, if they wouldn't cover it, if they covered it, what was required, and stuff like that. So I said, you know what, I'll go see him. If my insurance doesn't cover, I'll go stand in the other line for medical weight loss. And I will just be honest with him that I can't afford this. I cannot afford to do 3 meals a day supplement. As much as I would love to like avoid having another surgery, like financially, I cannot afford $150 a week for meal supplements. And I know you guys are going to say, just go to the gym, go do this. And I've done that. I had a trainer at one point. I followed her meal plan to a T. I worked out every single day with her, and I didn't lose any weight at all. In fact, I gained weight, and she told me that, oh, it's just you're gaining muscle. Well, I asked another trainer, I said, look, I just need to know if you are gaining muscle, shouldn't you be losing fat? And they balance each other out. And he said, yeah, for the most part, you're not going to gain very much weight. If you gain any weight, you should, or I'm trying to think of how, anyway, basically, he kind of confirmed that, you know, I should be losing inches on top of that. I can gain muscle mass, but I should still be losing inches. I wasn't losing inches. I wasn't losing clothes sizes. I wasn't doing anything. I saw this trainer for 6 months. No change. And I was paying her about $200 a month for training, which I don't know if that's good or bad, because I guess it depends on your area. But anyway, that's how much I was paying for training and following her meal plan and everything like that. And no weight was lost. Nothing was changed. You know, the only difference I seen in myself was my energy level was better. I did have a lot more energy than I normally do. Other than that, there was no change in my weight or pant size, shirt size, nothing physically was changing. And so after 6 months, I told her that I was quitting the program, that, you know, I was giving her all this money and nothing was changing, that I couldn't just keep throwing money out in the garbage like that. And so I quit the program, and I kind of just gave up on it. I said, you know what, it is what it is. Because at this point of my life, you know, I was still single, I wasn't diabetic at the time, and so I just kind of said, it is what it is, you know, I'll lose weight on my own time. But anyway, back to what I was saying before. I kind of got off on the rant that people are just going to tell me to go join a gym. I know if with this process I'm still going to have to join a gym, which I do plan on doing anyway. We plan on joining Planet Fitness because it is only like $10 a month. And with what I'm planning on doing career-wise, I'll have a lot more time to just go to the gym when I want to. So, and I'll talk more about that in a different video. However, so I've come to the conclusion that I wanted to consider the bariatric surgery. So after the class, I went to the guy just to see if my insurance would cover it or not. Well, I talked to him. He's like, okay, so your insurance will cover it, but you have 6 months of prerequisites before they will consider it. So I have to go through 6 months of dietitian classes. I have to do a psych evaluation. I have to do a health, so basically like they put you on treadmill, and I forget what it's called. And I have it in my folder, so let me tell you guys what it's called. It is called a BC exercise. So I have to do that, and then shoot, what's it saying? Okay, I have to do that, the psych evaluation, 6 months of dietitian classes, and I think you have to lose a certain amount of weight within that time frame. I can't remember. They're supposed to go over everything today in my first class. And I just lost my train of thought again. And then after that, after you do the 6 months, then the doctors will put into the insurance, hey, she finished all these, when can she have her surgery? And then at that time, they look at what you've done. If they see that you've lost like a significant amount of weight, from what I understand, like say I do this and then during the 6 months I lose like 50 pounds, they're gonna be like, yeah, you don't need it, you just need to keep on this diet plan. But then if I do this and I only lose like 10-15 pounds, they're gonna be like, okay, so you know what to do to lose weight, and at this rate it's going to take you yay amount of years to lose that weight, but by then you could be dead. Not really. I mean, that's really drastic. Or Jurassic. What is the word? Drastic? I don't know. Anyway, so basically I already spoke to the surgeon to kind of discuss like if he thinks this would be a good thing for me and stuff like that, because they have you speak to the surgeon. Because let me tell you, there were some skinny girls in this seminar, and I'm sitting there looking around and I'm thinking to myself, why are you here? Like, when I'm saying skinny, I'm talking about like they're probably 110, 120 pounds. No way they're overweight, especially when my goal weight, according to the health place, is like 130 pounds is what I'm supposed to be down to. I don't want to get below probably 160, to be honest with you. If I do, I do, but like I would prefer not to be that small. Nothing against people that are that small, but for me, I've never seen myself that small. Anyway, so I spoke to the surgeon and we discussed the different options, gastric bypass, gastric sleeve, and because I'm diabetic, he kind of went over both of them in detail, and he asked me, is your diabetes managed, or are you still working on getting it managed? I said, no, mine's pretty much managed. I stay down, between 80 and 110, where she would like me to stay. I don't really go above those numbers very often. If I do, it's usually because like I had a bad day or something like that and I was just off, or I forgot to take my pills one morning. But for the most part, it's pretty managed. And he said, okay, well, either option will work. He recommends that, he said either option will work. The gastric sleeve would technically be the best. For diabetics, he normally says the gastric bypass because it's better for like their medications and stuff like that. But with mine being controlled, he said that most likely I won't need my medicine probably after like a couple months after the surgery. I'm stumbling on my words. So the gastric sleeve would work, and he also went through like the risks and stuff of each, and the gastric sleeve actually seems like it has the least amount of post surgical problems. Like with the bypass, they basically just cut a pouch in your current stomach to make your food smaller, and they cut your intestines and reroute them and all this other stuff. So there's a lot of things that could technically go wrong in that surgery. A lot more likely to have an issue than if you were to do the gastric sleeve, where they cut your current stomach except for like a portion of it completely out and staple it, and everything else is still originally intact. Like your intestines are all, everything else, I don't know how to explain it, but your original route for your food outage to get down to your bowels, everything is all connected the same way. They don't touch any of that. They just cut your stomach out and staple it. They remove your old stomach completely. Um, it's kind of hard to explain. They have YouTube videos on the gastric bypass procedure, so definitely watch it because it's really interesting. But I think if I go through with the surgery, because I'm still not 100% sure I want to do it, but I have decided to go ahead and do the 6 months of classes and evaluations and stuff like that, that kind of prepares you for it, and it kind of gives me 6 months to decide on what I want to do. But I did decide that if I do go through with the surgery, I do want to go ahead and do the gastric sleeve, just because for me there's less problems. If there is any chance to have problems afterwards, I'm more likely to get them. Trust me. So I tend to take like the least risk procedures as possible because of things that have happened in the past. Like I had a tonsillectomy, and like a week later I busted a blood vessel and had to go back in for emergency tonsil surgery to repair that. She said it happens in 4% of people that have this surgery. So 4% out of that. So when I broke my neck, I told my surgeon, do not give me statistics. Please do not give me statistics. So I'm very against statistics because of what happened during my tonsillectomy. Anyway, so that is what I am planning on doing. I am planning on, if I decide to do the surgery, to do the gastric sleeve. There's one person that parked right next to me. They left. This person's acting like they don't know what they're doing. Now they're parking. Anyway, like, I tried to park down there and somebody literally cut me off and took my spot. I'm like, are you kidding me? So now I'm like a mile from the door. Not really, it's right there. But it seems so far away. As I talk about going into a dietitian class. Anyway, so that is it, guys, for this video. I will keep you guys updated on my bariatric journey. And at the end of the 6 months, I'll tell you what I've decided to do. Also, if for some reason I get pregnant within this time, then obviously the surgery would be postponed because I cannot have gastric bypass surgery or bariatric surgery if I'm pregnant. So there are a lot of different things that could happen in this 6 months process. Because I am not going to postpone trying to get pregnant. It's one of those things that if it happens, it happens, and it's something I've been wanting more than losing weight. So it's like, I would rather have my baby and then do the gastric sleeve than do the gastric sleeve and then have to wait a year before I can try to have a baby. Because that's one of the downfalls, is that you cannot they don't recommend you try to get pregnant until after a year. Actually, it said like a year and a half, but I've had a doctor tell me it was just about a year for the sleeve. So yeah, that's what we're gonna do. I'll keep you guys updated. Bye.